Hello, it's Dr. Rhonda Johnson, and today is Friday, May 14th, 2021. And today I'm going to be talking about COVID infection in children and teens and individualizing your approach to mask wearing following the new CDC recommendations. But first, an update on COVID infection in kids and teens. Folks, as of May 6th, last week, pediatric experts report that over 3.8 million children in the United States have tested positive for COVID-19 since the onset of the pandemic. And just last week, there were 72,000 children who were newly diagnosed with COVID. Repeat, 72,000 children in the United States who were newly diagnosed on the basis of a positive COVID test just last week. Now, pediatric experts report that over the past 2 weeks, which went from April 22nd to May 6th, there were a 4% increase in the number of children and teens who were diagnosed with COVID, for a total of over 143,000 new cases of COVID-19 in children and teens. Now, since the pandemic started, approximately 300 children and teens have died from COVID. While this number may seem small in comparison to the over 585,000 plus deaths we've had total here in the United States, we don't ever expect children to die, and their deaths are heartbreaking to their parents and to their families and to their loved ones. So once again, I'm appealing as a parent to my fellow parents to please protect your children. Children 12 through 15 can now be vaccinated for COVID-19 with the Pfizer vaccine. I realize, parents, you may have questions, and I encourage you to please contact your children's healthcare provider to get your questions answered, or utilize other trusted resources like your state or local health department and the CDC websites. But please, please, please don't use those conspiracy sources of information that you may find on social media. Now, to change the subject, yesterday I made a video about the new mask wearing guidelines for fully vaccinated people. And I received some interesting comments, and I'm sure you were talking about this recommendation also. But the bottom line from most of the people that I spoke with said they're going to continue wearing their mask. And I suspect many people will. And folks, you know I'm going to keep wearing my mask. So my decision is personal, of course, and it's based upon knowing my own health risk. And I encourage you to make your decisions based upon your knowing of your health risks. What we know for sure is that older people and adults of any age who have serious underlying medical conditions such as obesity, heart or lung disease, or diabetes, or who are immunosuppressed from diseases such as lupus, or people who have autoimmune diseases, or people who have had treatment for cancer. These folks are at a much higher risk of developing more severe complications from COVID-19 should they become infected with the virus. And we know that the virus is still transmitted the same way. So, we prevent COVID-19 disease effectively by getting the vaccine. We lower our risk of infection by wearing a well-fitted mask, by physically distancing ourselves, and by being in good ventilation. We know that if we're going to be in poorly ventilated indoor masks, we should probably still wear our mask if we're in poorly ventilated indoor spaces, if we are in a high-risk condition. And also, we should continue to do these activities outdoors where ventilation is good. And folks, ventilation has been proven to be critical as an infection prevention measure. So keep that ventilation going in your home as you plan activities, social activities. Outdoors is always best. Time to plan your picnics or your family reunions or your graduation parties. Do them outdoors. And again, use a little common sense. That's my message today. This is Dr. Rhonda Johnson. As always, my views are my own. Stay safe. And remember, the best COVID infection is the one that you prevent by never allowing it to happen.